Good evening, everyone, and welcome to the Ask Dr. Rawls webinar hosted by Rawls ND. My name is Tim, and I'll be your moderator this evening. Dr. Rawls, of course, will be joining us as well in just a little bit. We've had a lot of questions come in, thousands of questions actually, and we are definitely not going to be able to get to all of them, but we have read every single one and organized, sorted them, pulled together the most common questions, the ones that we think are most important that everybody know. And we also are going to answer some more less common questions tonight. So try to get you some answers to some of those. I know it's hard to get answers sometimes. So we'll go off the beaten path a little bit and throw Dr. Rawls some curveballs here. And you can see in this word cloud a lot of the things that came up, parasites, positives, silver, symptoms, neuropathy, all sorts of topics. So thank you for everyone who registered tonight and sent your questions in. And we're going to do our best to get to as many as we can. Dr. Rawls is the co-founder and medical director of Vital Plan, and also is a board certified medical doctor, holds his license in North Carolina. And he has written extensively on many health topics such as Lyme disease, fibromyalgia, chronic immune dysfunction, and many others. He's also recently been featured on The People's Pharmacy and is the author of the best-selling book, Unlocking Lyme, which we will be giving away later this evening. So Dr. Rawls, if you would be so kind to join us now, and we will get started with these questions in just a moment.
All right. Thanks, Tim. Welcome, everyone. Thanks for sharing your time with us tonight. For those of you that don't know me, I am a medical doctor, but probably my greatest credential is just having struggled with Lyme disease. I spent about 10 years of life and experienced virtually every symptom of Lyme. I was able to overcome it with a lot of hard work and primarily using herbal therapy. I did not personally find that antibiotics worked for me, and I chose the herbal route, which ultimately worked well and regained my life. So now at age 60, I'm living a very different life. There were an awful lot of questions, and I've read over all the questions, but I really don't know what Tim is going to ask me tonight, so hopefully he won't catch me too off guard, and I'll do my best. We're going to try to keep the answers short. I think that's very important. We're going to cover as much ground as we can, and so hang in there with us. Just a few notes on Lyme disease in general. Everybody wants specifics. What specific microbe do I have? What specific treatment do I need to do? And what I've learned about Lyme disease over the years is there really aren't any specifics, and everybody's path is a little bit different. And there are a lot of gray zones. And once you come to accept that, then that's really important. But most everyone comes to the table with this idea that they have a microbe and that they've been infected with by a tick, and the microbe is making them ill, and they must get rid of the microbe to get well. And I work with people to shift their thought toward the fact that they have chronic immune dysfunction, and it's not a microbe, but many microbes, and you have to not only suppress the microbes, you have to restore immune function. So with that, let's get started. Tim, what you got?
All right. Well, let's getting Lyme. How do people get Lyme disease? And when people talk about Lyme, they almost always talk about ticks. And so tell us a little bit about is that the only way to get it? I know there's been a lot of talk about the increase of mice populations recently in certain parts of the country. So talk to us about how people get Lyme.
Yeah, it's the primary trend, Borrelia, the microbe that's classically associated with Lyme, is by ticks. But there is some question of whether it can be spread other ways, sexually and otherwise, but it specializes in ticks. People don't typically get sick after a tick bite, though. Borrelia, Bartonella, all of these microbes that come with ticks are actually very, very common. And every tick carries many microbes. So every single tick bite, microbes enter a person's system. I think that's really important. And it's an imbalance of our microbiome that we have. Everyone has these things on board. So as our testing gets better, I think that we're going to find that lots of people are carrying these microbes. Typically, what I find is that people don't get sick after the tick bite immediately. That's a pretty rare occurrence. Most people probably have been carrying the microbe a good while, and they get sick when they come upon factors that disrupt immune function. It's always this perfect storm of things that come together, and that's when people get ill.
So what about folks that have a partner and that either kissing or through sexual contact? Is it possible? How about unborn children? Should they be concerned? Is it possible to contract it?
That's a really common question, and I think the answer is yes, it is possible. Kissing, probably not. Sexual contact, in utero transmission, less chance of through breast milk. Those are possibilities, but what you have to understand is that microbes tend to specialize in transmission routes. Another very similar or somewhat related spirochete, corkscrew bacteria, syphilis, specialized in transmitting sexually. It may be actually transmitted ticks. I don't think anybody's looked for it in ticks or ever documented a case, but that microbe is specialized in sexual contact. So you find high concentrations in seminal and vaginal fluids, and it does cross utero. Borrelia, another spirochete, specialized in ticks. So it is possible that you don't find high concentrations of the microbe in semen, and you don't find it in high concentrations on vaginal fluid. So yes, I think there are cases that it is transmitted in utero and spread sexually, but that's not going to be as typical as tick-borne routes.
Okay. Yeah, that's interesting because we definitely had a lot of questions. A lot of parents out there wondering if they should hold off on having kids until they feel like they're healthier. Is it possible? I've got one from Heather here. It says, can I get to a place of remission or dormancy of Lyme and its co-infections that it's possible to safely have a baby without transmitting any of it to them? I do not want to risk giving it to someone else.
I think that concept of dormancy is really important. I really don't think there's any way to eradicate these microbes from your body. And there's no evidence that antibiotics or anything else will do that. In fact, there's a fair amount of evidence to the contrary. So symptoms are a pretty good guide. Testing for these microbes is notoriously difficult because the concentrations of microbes in the body are so remarkably low. People get sick from the way the microbes manipulate the immune system, not overwhelming infection. So when it's a matter of just the following that track, and what was that question again, Tim? Sorry, lost my train of thought.
Just is it possible to get well enough so that they can feel confident that they're not going to give it to their baby?
Sure. It's again, symptoms are the best judge. Really tracking these microbes in the body is really difficult. So if a person feels well, then the microbes are dormant in their tissues, and the chance of them transferring them are really, really small. Really small.
Good. It sounds like there's some hope then. That's good to hear. How about let's talk a little bit more about testing and diagnosis, since we're going that direction. In Unlocking Lyme, you explain a little bit about the stealth nature of Borrelia burgdorferi makes it very difficult to diagnose. Can you explain what you mean by that?
Well, it's when we look at all of our testing modalities, whether we're doing immune testing for antibodies, or whether we're testing for particles of the microbe with the DNA, we're still, you have to have a certain quantity of the microbe, and you have to know what you're looking for. So when you look at tick-borne microbes, we're scratching the surface in what kinds of things that we can test for. They discover new species of Borrelia every single day, and there's so many other things out there that we can get that can cause similar kinds of illness. So all of these stealth microbes, they become part of us. You know, we all carry these kinds of pathogens, so they're not unusual. So when you look at testing, all of the labs are focusing their testing on acute diagnosis, somebody that gets ill and they have a load of microbe in their body. But because most people don't get sick after the tick bite or don't notice it until long after the tick bite, most people being tested have chronic infection. So by the time the microbe is dispersed throughout the body and is deep in tissues in low concentrations and is growing very slowly, it's really difficult to find it. You don't find very much of it in the blood, and it's really, it is challenging. Generally, I try to make people recognize that if you have all of the symptoms of Lyme disease, then the chances that you're carrying stealth microbes of some kind is 100%. And you have chronic immune dysfunction. There's a pretty good chance that you have Borrelia. But because antibiotics don't work very well for those kinds of infections, knowing the specifics at this point isn't necessary to get well from these kinds of illnesses. So this idea of finding the microbe, targeting the microbe with specific therapy to get well and then test for cure, it just doesn't work with Lyme disease. It's totally dysfunctional and just not something that we're going to find is very valuable. What we will find over time as the testing gets better, and it will, is that an awful lot of people are carrying these microbes who aren't sick because their immune system is healthy. In fact, I think we're going to find that they are quite common.
Very interesting. Yeah. So I think that answered a lot of people's questions about diagnosis. We've got another kind of specific one here from Rachel. She says, my son tested positive in 3 of 5 bands on the Lyme test, but his doctors won't recognize that as having Lyme. Should I still pursue treatment for him? He's had multiple tick bites in the past 5 years. He's only 12 years old.
Yeah, it's the chances that he has Borrelia are pretty high, and it's but again, knowing the specifics isn't necessary for someone to get well, because antibiotic therapy and targeted such therapies the alternative therapies that we're looking at, the things that are restoring immune function. Again, this is a disruption in the microbe balance of the body with chronic immune dysfunction. It's a pot boiling over of multiple stealth microbes. So this idea of trying to find a specific microbe and holding back treatment until you find that microbe just doesn't make any sense. Why not go ahead and start a therapy like herbal therapy that has great coverage, suppresses these microbes, restores immune function, reduces inflammation, balances hormones? Why do you have to wait for that diagnosis before you start that? So it's be proactive. It's really important.
Dr. Rawls, yeah, I think that's such a huge part of your message for people out there. Maybe I'll bring up the therapeutic pyramid. Since you're talking about the why wait, maybe you could talk a little bit about the notion of restorative therapy. Just kind of introduce that concept for people that aren't familiar with it.
It's actually the virulent scale, Tim. Oh yeah, okay, we got it there. I try to just separate therapies out into categories, and looking at the value of these things for treating these kinds of microbes as stealth microbes is really important. Um, Restorative therapies are things that enhance immune function and enhance the healing systems in the body. But because healing takes time, sometimes symptomatic therapies, which can include drugs, are valuable. And I leave off the heroic therapies, antibiotics, ozone, hyperthermia, all of the things that come with a price of pretty extreme toxicity and often cost. So this is the first time we put these two illustrations together. But when you look at the concept of virulence, virulence is the ability of a microbe to cause illness. So Ebola, HIV, those things would be right at the top, and they're going to be better managed with things that are more potent, more heroic. Other things like stealth microbes that are down at the lower end of the scale that are actually more common are better managed initially, at least with restorative therapy. So it's a good place to start. Restorative therapy, the cornerstone of it is herbal therapy. It includes dietary modifications, the way you approach life, sometimes supportive alternative therapies of various kinds, things that don't cost that much, and they are generally pretty darn effective. But the toxicity of these things is extremely low, and that's the most important part of this whole. Start with the things that have the lowest amount of toxicity, and then move to the things that are more toxic or more expensive if you need to. But if everybody had that triangle, that pyramid shape in mind, and was building that restorative base before they went chasing heroic therapies, we'd have Lyme disease under control quite well. And that's the message that we're trying to broadcast, is you really don't need to fly across the country to get that kind of care. It's very available.
Thanks. Yeah, that's such a big thing. People sometimes testing can be so valuable, of course, and you acknowledge that all the time. But why wait when you can start some of those restorative things right away that aren't gonna cause any risk and can only help. So thanks everyone for bearing with us. I know Dr. Rawls might have cut out for some of you all sound or video, so that'll just happen occasionally. Stick with us here, and we'll keep on working our way down these questions. Yeah, let's move on to some more treatment questions here. As far as a medical provider, I know you're big that people should maintain a relationship with their healthcare team, since that is valuable sometimes. But do you feel like they need to have access to a Lyme literate medical doctor?
That's a hard question to answer. There are many well-meaning physicians out there that consider themselves Lyme experts, and a lot of people have worked hard to gain knowledge. But that knowledge is very, very diverse. And I've seen too many people that are in crisis because they are in desperate financial straits because they blew their entire retirement and all of their savings chasing a dream for a heroic therapy with some doctor across the country, and it can run 30, 50, $100,000, and it's gone in a flash. Some of these doctors won't let you even in the door until you drop 3,000. So I wouldn't exclude Lyme doctors, but do your homework before you see somebody. Find out what kind of therapies they use and what they typically cost. Get on the internet. Talk to other people. That being said, I didn't have the luxury financially of going to see a Lyme doctor. I had to bring things to my doorstep. And I was miserably ill as most, I'd say 90% of the people I've talked to over the past 10 years. And I didn't go see a Lyme doctor. I figured it out, and I used things that ended up building that restorative base. And it's come to make me appreciate that that's essential. You really have to build out that restorative base to get well. Now, as far as your local provider, they can be a real asset. They're not going to know how to treat Lyme disease. And you really don't need to ask them to try to treat Lyme disease because they don't understand it. And because they don't understand it, they're not going to be able to help you properly. But they can be there just for everyday things, symptomatic things, labs, just basic labs, making it sure it's not something else besides Lyme disease that may need to be treated in a different way. So maintaining a good relationship with your just local health care provider can be really valuable, but you can't overwhelm them or ask them to do things that they aren't capable of doing. I think that's the key.
Yeah. And, as far as conventional providers go, usually the place that most people start with is antibiotics. And so there were a ton of questions about that. I've got one here from Kat, and she says, I am taking 2 antibiotics for Lyme disease for 5 months now. Is there any data that shows the success rate with antibiotic treatment? I know some people have success, and if so, what's the average time that people are usually on it?
Yeah, that's a difficult question to answer. There are no studies showing antibiotic therapy for Lyme disease, for chronic Lyme disease, is effective. None. There are people that get well. In my opinion, those are people that their immune system rebounded enough that the suppression of the microbes was enough that they got back on their feet and they were able to go on and get well. Immune function is key. There's only one thing on earth that can put these microbes back in their place, and that's your immune system. There is no other therapy on earth. Herbs can help that. Sometimes antibiotics can help that. But when you start using antibiotics, you enter a race. And I think this is very important to recognize. I often compare 2 types of infections. An acute pneumonia in your lungs, you have a fast-growing microbe, very consolidated in one place, very aggressive. You can take biopsies in that area, and you're going to siphon off lots of bacteria. And those kinds of microbes conventional antibiotics are built for. So when you hit those kinds of microbes with antibiotics, synthetic antibiotics, they die very quickly. The counts go down, the immune system catches up. 2 days to a couple of weeks, the person is well. These stealth microbes infections are totally different. You're talking about microbes that are in the deep recesses of the body. They live inside cells. They grow very, very slowly. And they have really interesting ways of evading the immune system, but also evading antibiotic therapy. So what most doctors do that try to treat chronic Lyme disease is they realize that 2 days to a couple of weeks that would work for a pneumonia wouldn't work for Lyme disease. So they hit you with weeks or months or even years of antibiotics. Typically what I see is some people feel better, but they ultimately don't. They often ultimately slide back because the chances of eradicating these microbes is very low. So what ends up happening is you because these things are not growing any faster and they're very much like your normal flora, but they're more protected than the normal flora, then you hit your normal flora a lot harder than you hit these microbes. So eventually you're going to wear your normal flora down, and you're going to have gut problems, and you're going to get Candida, and you're going to get C. diff, and you're going to get all these pathogens that come out that become antibiotic resistant long before you get these stealth microbes. So there are too many people out there that are actually harmed quite a lot by long-term antibiotic therapy. As I go through time, I am less and less a fan. I recognize that some people have gotten well, but I think there are higher percentages of people that regain their health other ways.
Yeah, thanks. So I've got another question here. This one's from Patty, and I think she's echoing some of the sentiment there. So she just received her third tick bite, got the bullseye rash, got symptoms. This time she feels like it's harder to beat. She knows she's got a co-infection of Ehrlichia, and she said supposedly doxycycline is the antibiotic of choice, but I've been taking that for months and I'm not kicking it. Recently I started alternative therapies, and I do seem to be seeing some support. But she says she's athletic and she wants to stay that way. Are there any other non-medicinal treatments that you would recommend?
Well, lots of them. The book is full of them, and the programs we do, and that's what
Where can we start here then?
we provide a lot of support. But it's but Ehrlichia is a little more virulent than some of the tick-borne microbes. Rickettsia, Anaplasma, Ehrlichia do tend to respond to doxycycline because they're a little bit more virulent, but not always. And at this point, we don't know, quite frankly, whether it's Ehrlichia or something else. It may be that the antibiotic did affect the Ehrlichia, but also adversely affected immune function. And now other stealth microbes are thriving and causing problems. Also, there are many different species and strains of Ehrlichia that act very differently, and some of them tend to be more antibiotic resistant. So it comes back to the same thing. I think if someone has a diagnosis of Rickettsia, Anaplasma, or Ehrlichia, at least a month, if not 2 or 3, of doxycycline can be reasonable, but certainly not any more than that. But personally, I would start concomitant herbal therapy at the same time, because you're still dealing with immune dysfunction that's been brought on by this microbe, and there are always other microbes present that aren't going to be affected by the doxycycline as much. So always supportive therapy, build that restorative base, do the herbal therapy, because you're never, this thing of targeting a microbe is just dysfunctional. It's not the way to get well. You have to approach the chronic immune dysfunction in the whole thing. I keep saying this same theme because it's so remarkably important.
I want to go back to antibiotics one more time, and then I do want to ask you some questions about herbs.
Yeah, all right.
What about a lot of Lyme specialists out there believe that all... Can you hear me okay?
Yeah, sure, go.
Okay. Yeah, so I was just saying, yeah, about antibiotics again, a lot of Lyme specialists believe that alternating antibiotics will work. What's your opinion on this? Basically pulsing. Is that higher likelihood of being beneficial to folks?
It's another one of those things that people want specifics, but there are none. We honestly don't know. There is some logic behind it, and that is that if you pulse the antibiotics, possibly you won't hit the normal flora quite as hard, and therefore you won't disrupt the immune function quite as much, and possibly that might help the person rebound. But nobody knows the absolute answer to that. But it's very easy to say, well, if you're going to do that, why don't you do herbs at the same time? Because the herbs are going to help restore immune function and help suppress all the microbes that antibiotic isn't getting very well. And it might have a positive effect on the normal flora that keeps the antibiotics from being quite so disruptive. So yeah, I think probably pulsed antibiotics makes more sense than continual antibiotics, but we don't know. There are no studies. The folks are shooting from the hip with that one. But again, build that restorative base. You're much more likely to get well.
And part of the reason that people recommend pulsing, if I understand correctly, is to help avoid the issue of resistance. Is that correct?
Yeah, but I don't know whether that. There's no proof of that. It's been looked at over the years, and there's just not enough data out there to say that that's the case. And resistance is it's hard to put a finger on that one too, because you don't know which what bacteria are you talking about? Are you talking about the bacteria that you're targeting, these stealth microbes, or are you talking about C. diff and other microbes in the gut that normally are suppressed by normal flora and become antibiotic resistant when you keep using antibiotics to them, or Staph aureus? So that's people that are using that, I don't think are necessarily asking all the questions that need to be asked.
Great. So yeah, so if people do decide to use antibiotics, and it's fine with their doctor, you feel like using herbs along with it is a great idea. The herbs aren't going to have that same resistance issue, wide spectrum activity.
Yeah, why not? I mean, herbs are inexpensive. The toxicity of them is profoundly low. Herbs have this wonderful property of not disrupting the normal flora. At least most of the ones that I call the restorative herbs are suppressive. They're not as potent as an antibiotic. I wouldn't use them to treat an acute pneumonia. That would be ridiculous. But they have this wonderful suppressive effect that actually enhances our microbial balance and enhances our normal flora, and it helps that balance in the gut, which is also important for so many illnesses.
Yeah. Cool. So is there anything to know about if people are going to transition from taking antibiotics, etc., to alternative treatments such as your herbal protocol or another herbal protocol? Is there anything to know about transitioning?
Not really. I do find that people kind of get caught on this treadmill of they get on an antibiotic, they feel better for a while, and that gradually they lose that because the antibiotic is affecting their flora and their normal and their immune function and that sort of thing. So they get off of it, and then they go right back to where they were, and then they're on a different antibiotic. Or people that every time they go off an antibiotic, they get ill again. And that's because, sometimes the antibiotics are suppressing, but they're also suppressing immune function, all right? You have to have good immune function to get well from this illness, or really any illness for that matter. So if you're not restoring immune function while you are in the process of treating with an antibiotic, then as soon as you go off the antibiotic, all these things are just going to flourish again, and you're going to be right back where you started. So definitely start on the herbs and then gradually taper off the antibiotic. There's no magic there. The herbs work very differently than antibiotics. You're not going to interfere with the antibiotics or vice versa. So yeah, there's nothing wrong with starting the herbs and then gradually tapering off the antibiotics.
Great. And I meant to thank Kathy for that question about transitioning from antibiotics, and Amy for the question about using herbs and antibiotics together.
All good questions.
For people who decide, yeah, great questions. For people who decide to adopt a herbal protocol, how long should they expect to follow it, and how will they know when to stop it or cut it back? I don't know who sent that one in, but also a great question.
It's the question everybody asks, when do I stop this thing? And it's when you want to give up wellness, basically. Because when you look at what herbal therapies are doing, they're affecting all the processes of chronic illness and aging. Right in the middle of it, I'm in the middle of a research project looking at aging and how herbs affect that. And it's so you don't necessarily need to keep high doses of herbs forever, but the herbs are doing a wonderful thing. So I use myself as an example. I've been taking herbs for over 10 years, continually, twice a day. Not always the same herbs, but usually a pretty good assortment of herbs twice a day. And 5 years ago, I would have said, well, I'm recovered. I've been getting a little better every year since then. And And sometimes you lose track of that. I mean, it's sometimes hard to understand aging because I feel so much different at age 60 than I did at 50. At 50, I had chronic knee pain, chronic right hip pain. I assumed by now that I would have a right hip replacement, low back pain, neck pain, and I don't have any of those things anymore. So the healing propensity of the body is profound. It's really remarkable. So most people, if you can consistently do it at least until you're well, and that's highly variable. Some people that's 6 months, some people that's 6 years. Then I think that's important. But what I want to do with the education that I provide and the programs that we do and the books that I write is help people understand the remarkable value of phytotherapy, of these chemicals that come from plants and how they interact with our biochemistry to protect us. And people have been using these things through history, but never have we understood their application more than we do today. And so not doing these things, I think, is not necessarily a good idea.
Great. And there were tons of questions about Dr. Rawls' herbal protocol. Just want to let everyone know that's not the focus of tonight, but we will be sending an email for those that are interested. We'll follow up with an email so that you can learn more about it, but we're trying to keep it broader than just that, so we won't be diving into that very much. If you are already someone that is following Dr. Rawls' herbal protocol and you've got a specific question about it, please do feel free to send an email to info@vitalplan.com. Support team there will be happy to help you. So just wanted to let you know that we will be following up with other folks that are not on the protocol but are interested. We'll have more information later. Before we get into a couple other questions, I just wanted to mention there are definitely lots of questions about other alternatives: ozone therapy, stevia, silver. We've got so many great questions. Those questions, a lot of those are answered on Rawls MD in the blogs. So if you just search there, you can read more about Dr. Rawls' opinion on that great stevia article. Next question for you, Dr. Rawls. How do I know that what I am doing is enough? I don't want to be going backwards and ending up with chronic Lyme. Very general question here, but any thoughts on that?
The big thought is, I just did a tour of the Northeast and met a lot of people that were chasing various kinds of heroic therapies, and they would go from one thing to another, and a lot of them were really worn out. And it wasn't the Lyme that was wearing them out; it was all of these really toxic therapies that they were doing, and so I really think it's important to keep your focus on what you're trying to achieve with the whole thing, and so just focusing on that restorative base of just keeping tuned in to where you're going, it is really more important than anything else you can do. So that's important. Is just staying focused, building out. It's lots and lots of little things. It's not one big thing that's going to get you well. And when you give up chasing that one big thing and start doing all the little things to rebuild your immune system and rebuild your system, that's when you're ultimately going to get well. That's what's going to take you to the finish line and get your life back. So it's not just an herb; it's many herbs, and there are other things beyond the herbs. I recommend thymic extract. Some people are using CBD to help with pain and just for that immune modulation. Most everybody finds that they have to do the diet. You really got to be particular about your diet and how you go about life, and you've got to do life differently. You've got to undo the things that got you in this situation in the first place. People get sick because their immune system gets disrupted. You have to look for the things that cause that immune disruption. Sometimes it's a lot of little things, but I've had unusual cases You know, people that are trapped in a house full of mold, people that have, I talked to one person who ended up in a house that she found out had termites, and they had saturated the house with chemicals, and she got sick afterwards. People that are affected by electromagnetic energy, some people more than others, that can be a factor. So when you look at these factors, these system disruptors, and start undoing the system disruptors and then complementing it with herbal therapy, the cool thing about the herbs is they're affecting all of these system disruptors because plants have to deal with these same stress factors that we do. And because they do, then then plants are producing this spectrum of biochemicals, not just against the microbes, but against a lot of other forces that affect us also. That's why I'm finding the idea of plant medicine, phytotherapy, so interesting as it applies to anti-aging and chronic illness in general. I think there's so many wonderful things out there that we just haven't been paying attention to. And the evidence is accumulating that we really need to start, no doubt about it.
What about the idea that some people put out there that Lyme disease is actually more viral than bacterial? And if that were true, have you ever heard anyone about using higher doses of proteolytic enzymes against those viruses?
Yeah, I don't know of anybody that's documented that proteolytic enzymes kill viruses. More what proteolytic enzymes are doing, as far as the documented evidence, are reducing inflammation by breaking up immune complexes, which could be originating from food sensitivities, viruses, bacteria, or a number of things. So that's what you're mainly doing with proteolytic enzymes. As far as viral, people feel viral, but you have to understand that when people are sick from a virus or a stealth microbe like this, it's not the microbe necessarily that's causing them to be ill. You get a bad cold, that sort of thing. It's not as much the microbes, but it's the reaction of the immune system to the microbe and how the microbes are manipulating the immune system. So when you have a dysfunctional immune system, you've got this boiling pot of microbes. So it's not just Borrelia or just Bartonella or just Borrelia and Bartonella and Babesia and Mycoplasma. It's many microbes, and then you have reactivation of a number of different types of viruses in your body. So you've got this spectrum of all of these things going on all at once. And that's what chronic Lyme disease is. It's not an infection with a microbe.
Yeah, great question, Thomas B. Thank you for sending that one in. Because typically, we think about Lyme just in relation to Borrelia, but there are a lot of co-infection questions, and some of those can be viral, and some of those things could already be dormant and kind of come back out, as you're dealing with Lyme. So, Dr. Rawls, in relation to those co-infections, do you feel that there's a certain order in which Lyme and its co-infections and other typical ailments, such as parasites, mold, heavy metals, is there a particular order that you should go about trying to fix those issues?
No. This thing of targeting specific problems doesn't make any sense. It's when you're doing that, you're basically targeting symptoms. But again, it's not the microbes as much as the chronic immune dysfunction that's allowing these microbes to flourish. So if you're addressing the chronic immune dysfunction, you're going to be addressing the individual microbes. Sometimes with more aggressive microbes, certain strains of Babesia are more aggressive or virulent. You do have to add on more therapy, but it's generally not something that you're targeting specific microbes or need to. You have to understand the reasons why those things are happening. Why are these things flourishing in the body? Why does a person have Candida, not how do you treat the Candida? And when you start looking at Candida from the point of view, so often, Candida is a good example. People get Candida overgrowth in their gut. Everybody on the planet carries Candida, absolutely everybody. And the reason that Candida doesn't flourish in the gut is because normal flora, including normal flora yeast, suppress the Candida. All right. So if you levy a potent antifungal agent at them really, really hard, what you're going to do is suppress the Candida, but you're also going to suppress all of the normal flora yeast that are suppressing the Candida also. So as soon as you let up on that antifungal, it's all coming right back. So you have to address looking at how we rebalance that microbiome and restore immune function to put these things back in their place. And as you're looking at this comprehensive restorative protocol, you're enhancing the detoxification systems in the body, you're restoring normal adrenal function, you're balancing the hypothalamus. So you're doing all of it at one time. And that's the value of a restorative approach, is you're not singling out and having to do each one of these things individually. It's part of the recovery process.
So thank you, Jody, in California, for that question. So am I hearing that it is important to know what co-infections are, but it's not important what order you do them? As long as you're working on everything, it's all going to collectively get better? Or does it even matter whether you know what co-infections you have? Should you get tested for individual co-infections?
Sure. And I think that's a reasonable question, and I'm not suggesting that no one should ever do any testing. But what I can say is a lot of people get well without doing any testing, and I've seen a lot of people squander a huge amount of money doing testing that really wasn't valuable to them. So when I talk about building that restorative base, what we're doing is we do, we right up front you can say, okay, no matter what we do know, there are a lot of things that we don't know. So if we know that Borrelia and Mycoplasma and Bartonella are on the table, there may be things that are identified that are tick-borne pathogens that we're not even recognizing yet, because there's lots of things that come up every year that are new. We know that there are hundreds of microbes carried by ticks that can potentially cause illness, and we're testing for a handful. So what we do know may be less than what we don't know. So when you look at a comprehensive herbal protocol and that restorative foundation, instead of covering for a microbe or treating microbes specifically, it makes more sense to build the base to suppress those stealth microbes as much as we can in a broad way and build the immune system at the same time. So I generally start with a basic assortment of herbs that have a nice suppressive effect on a broad range of different microbes. And the person works through that, and you try to be as conscientious as you can. It takes a while. Some people, to get up to a full dose, will take them a month or two. So if a person is into it 3 to 6 months and they're not getting well with that basic restorative foundation, that's a time to start spending some change on further testing. Is there some other virulent microbe there that we need to cover for a lot more aggressively? But a question that we also get asked a lot is, what do I need to do to cover Babesia? And what I can tell you is, Babesia is often compared to malaria, and but it's not nearly as virulent. Malaria is a much more virulent microbe. When I started researching Babesia in the medical textbooks, it was a footnote that basically said, well, most people who get it don't get ill. And that's true. Most people who get it don't get ill. But people with really bad immune dysfunction can get really ill in certain situations. So if someone is not getting well, that's the point to really start aggressively testing for and possibly treating, either with other herbs or possibly even at that point antimicrobials. But even the antimicrobials, I hear a lot of people say, well, do your herbs cover Babesia and these other things? they provide that basic level of suppressive effect and the immune support. So I generally start there. But we have a lot of people going, well, okay, do I need to take Sida acuta and Cryptolepsis and Alcoria and all of these really more potent herbs right off the bat? I don't necessarily think that that's necessarily a good practice. If you're getting well with the basics, save those for a backup plan if you're not getting well. But here's the deal. Your basic suppressive herbs are not disrupting the normal flora. The more you reach an herb that has systemic antimicrobial properties, the more apt, like Cryptolepsis, Sida acuta, and some of these others, the more apt they are to affect the flora in the body. So why not save those guys? They're great herbs. They have a wonderful place, but why throw all your guns away right in the beginning? Start with the basics and then build out from there. And I think that's a really important message, and people that are doing that find that it's much more cost effective than what most people are doing with this random across the board testing and trying to cover for every single microbe that we test for. So does that make sense, Tim?
I think so. Yeah, I think that's a great answer because people definitely get overwhelmed with all of the different options out there, um, and yeah, having that wide spectrum coverage is a great place to start. I think that makes a lot of sense. Um, I I was just preparing the next question. So there are a couple of questions on symptoms, but before we go on to that, know there are a lot more questions about co-infections. Unlocking Lyme covers a lot of this information. There are chapters that include more information about that specific testing if you feel like you want to know more about that, in addition to herbs and how they work with this co-infection. So more reading there, and of course on Rawls ND. Dr. Rawls, how about Lyme and its possibility to elevate cortisol levels and lead to adrenal fatigue? Emily W. is curious if there's a connection there. Is that possible?
Right. I think you have to define adrenal fatigue, right? And a lot of conventional physicians really struggle with that diagnosis of adrenal fatigue, because if you do just random testing of cortisol, technically it's normal. So what that means is the adrenal gland isn't broken, all right? When you have something called Addison's disease, where the adrenal gland can't produce cortisol anymore, then you've got an adrenal gland that's broken. So when we use that idea of that concept of adrenal fatigue, we're actually talking about the hypothalamus. The adrenal gland is controlled by the hypothalamus. The hypothalamus, through the pituitary, controls all of our maintenance activities, our day and night cycles, our thirst, our hunger. All of these kinds of things are controlled by the adrenal, by the hypothalamus, and it works through the pituitary to control the adrenal glands, which are basically maintenance functions in the body. The thyroid, which is metabolism, and ovaries and testes, reproductive functions. So what becomes out of balance in adrenal fatigue is stress adversely affects the hypothalamus. It basically it short circuits the system that it can't keep up, and it's being driven too hard, so it tends to drive the adrenal glands to the point that the adrenal hormones become very dysfunctional. Sometimes low when they shouldn't be low, and high when they should. So it can present different ways. Some people have high levels of cortisol continually. Other people don't have high levels when they need them to get going, and they just feel exhausted all the time. But it's really more of a dysfunction of just pushing the gland too hard, and the hypothalamus being driven by chronic stress. So it's not the bacteria as much as just the stress of the illness and the stress surrounding the illness, of the emotional stress or physical stress or whatever stress factors are contributing to the whole thing. So when you look at that concept, again, the herbs are really wonderful. We have a whole set of herbs that we call adaptogens. And one of the key features of adaptogens is they balance the hypothalamic pituitary adrenal axis. So they give feedback mechanisms that basically just help let the pressure off of the hypothalamus so it's not driving the adrenals so hard and the adrenals can recover a little bit. There are other herbs that actually help support the adrenals, like licorice. But you have to be careful with licorice. If you use it too much, it will start dysregulating that whole feedback mechanism. So we use a lot of adaptogens. There are adaptogens in the program that are very important for balancing that really important central pathway. That is one of the key parts of getting well is balancing the HPA axis and restoring not only adrenal function, but metabolism and all of the normal processes in the body. But you have to let the pressures off. You have to change your lifestyle. You have to change the way you go about eating, and you have to take the herbs. And as you do that, the adrenal gland will recover, as opposed to someone with Addison's disease, their adrenal gland can't recover. As far as the idea of using cortisol to treat adrenal fatigue or cortisones of any type, steroids, I don't agree with that because you're going to suppress the adrenal function even more and you're going to become dependent on the steroid. And because we can't mimic the normal cycles of the hypothalamus, it suppresses immune function. And if you suppress immune function, you will not get well. Simple as that.
Great. Hope that was helpful, Emily. Thank you for the question. And speaking of diet, there are a lot of expert opinions out there about how to heal your gut. It seems like your approach is to start with what is easiest to digest, says one viewer. Would you say that's accurate?
Oh, yeah, absolutely. I mean, I had really bad gut dysfunction like everybody. I had terrible leaky gut. I did a food sensitivity panel and I had a lot more things that I was sensitive to than the very few things that I wasn't. So it put me down to a very a simplistic diet right in the beginning. But basically what I did when I looked at diet was looked at all the contributing factors that come in food and how they affect the GI tract, and also in relation to our traditional foods that we've eaten through time compared to the heavily processed things that we're eating now. So it's not only glutens, it's lectin proteins, it's the associated microbiome imbalance in the gut. And you have to address all of those factors. So I start people off with a really strict diet because most people come to the table with gut dysfunction. And we start them off, basically it's cooked vegetables and chicken or fish like salmon and rice. Rice is very forgiving and has very few negative properties. And we get them on better fats and better foods. People that don't have that much gut dysfunction, we're going to progress out of that phase pretty rapidly. But some people actually stay in it for months or even a year just to restore that gut function. Lots of things that you can do to support it. Ginger tea, chlorella, the freshwater algae, absolutely wonderful. And I found just all kinds of tricks up my sleeve because of all the things that I have had to use personally to restore my gut over the years.
Great. Yeah, that's a really common question too. And Dr. Rawls referred to the eating plan, and one of the things that we've got to make it easier for you all is I'm going to display a little download button. I think you should be able to see that. If you're mobile, it might need to navigate somewhere else, but on desktop, you'll be able to see it right here, and you can download that. And you'll see Dr. Rawls' clean grocery list. It's all the foods recommended. A lot of this is in the book as well, but wanted to make something handy for you all. So you can download that just by clicking the button. Dr. Rawls, Tammy wants to know if these food sensitivities, which a lot of people develop during Lyme, such as dairy or gluten, is it temporary or is it usually an ongoing issue?
Yeah, it's well, again, personal experience and experience with so many people. Basically, leaky gut is you compromise the barrier between the intestines and the bloodstream, and at the same time, most people aren't digesting proteins. So the proteins that you eat most commonly flood across into the bloodstream and overwhelm the immune system, causing a range of symptoms that can often be very, very much like Lyme disease. As you heal the leaky gut, a lot of those things will gradually resolve. But once the immune cells are activated to those proteins, it takes a long time for those immune cells to just wear off and not be present any longer. So so them things are retained. Some people have more food sensitivities than others. We find that the more foreign the protein is to us, though, the more problems that people have. Gluten is a very, very foreign protein. A lot of people develop soy sensitivities and a lot of other things. When I was going through my whole situation, I was lactose intolerant, so I gave up regular milk and started on soy milk, and I did that for 6 months to a year, and at that time I became very sensitive to soy. I mean, really sensitive, and started having allergic reactions to it. So then it was to almond milk, and sooner or later I developed almond milk sensitivities, and then coconut, and I went through all the different milks, and now I'm back to lactose-free regular milk, pasture-raised milk, and that doesn't seem to bother me. But I found personally, and this is true of a lot of people, that animal proteins are less foreign to us than a lot of the plant proteins. You can get through this thing and be a vegan, but it's challenging, quite frankly, because so many of the vegetable proteins are foreign to us. You have to stay with pea and some things that really have very minimal reactivity. But so it is some things that you have to work around. My thing is nuts. I still can't eat nuts, and it drives me crazy. I generally stay away from wheat. I cheat every now and then and seem to get away with, but nuts, I can't do nuts. I mean, it's just, I really, really miss eating nuts. But it's a little bit different for everyone. And I'm hoping one day that I can eat nuts again.
Well, it's good to hear a lot of the other ones have been temporary. Hopefully you guys got that shopping list. I think we will be emailing it afterwards if you weren't able to snag that, but it's a really handy resource. Let's move on to just a couple last questions. Thanks everyone for sticking through here. We've hopefully answered a lot of your questions, and we've got just a couple more before we wrap up and share that coupon code for the book, and also a couple other resources. How about the lifestyle piece of it? Diet is definitely important. We've got a question here. Someone wondering, can meditation help relieve their symptoms of Lyme? What do you think?
Meditation does a lot of wonderful things. It is another way that you can things balance the hypothalamus, and it's I learned that if I could just bring myself, if I could sit in a relaxed place and do relaxed breathing, and I would try to bring myself down to a level that I almost touch sleep. And if I could do that, even in a 15-minute period, it zeroed all of my stress hormones. So just that breathing, just focusing on breathing. So you don't really have to sit in an odd position and do this regimented thing. It's just a matter of being in a quiet place, focusing on your breathing, trying to focus out of other kinds of thoughts, and that reduces stress. And reducing stress, stress is one of our primary immune disruptors. That's one of the things that is driving so many people's illness. So if you can free yourself from that immune disruption factor, then that can do profound things for your recovery. Now, have there ever been people that have overcome Lyme disease by meditating alone? Probably, but it's going to take an awful lot of effort to get there. But I am sure there are people that have been successful because stress seems to be such a driving factor of keeping us ill.
Thanks. Yeah, it's huge. It's such a it's harder. It's easier said than done sometimes, but it's totally worth it to find a way to deal with that stress, whether it's meditation or whatever it is for you. How about aerobic exercise? That's another one. We've got an athlete here named Charles that says he's been an aerobic athlete for years. Would you say that for some people, aerobic exercise at an intensive level is beneficial, or in general, is it usually more harmful for someone that's working at healing themselves from Lyme?
Yeah, unfortunately, almost all the time it's harmful, and it's we all of us that were athletically active before this thing have this thought of just I'm going to drive through it. I'm just going to push as hard as I can, and I tried to do that, and you just keep hitting a wall. And basically, what is going on is your whole body is inflamed. And when you rub bones together and muscles together, you're going to where you're going to exacerbate that inflammation. You're going to make your situation worse, and you're going to set yourself back. The goal with recovery is generating endorphins. Endorphins are those feel-good chemicals that come with exercise, and they stimulate natural killer cells. Natural killer cells are the prime cell in your body. They're gobbling up these offending infected cells that have been infected with microbes. So, and the microbes are doing everything they can do to suppress your natural killer cells. So, exercise stimulates stem cells, which you need for recovery. So, I generally recommend that people do enough to work up a light sweat, and do that as consistently as you can. That starting out, I was able to walk. There's a state park near here with sand dunes, and it's a 3-mile trail all through the sand dunes and then back to the parking lot. But you can cut off the trail and walk the beach back. And when I started, I could walk half a mile and then quit and walk the beach back, and that was all I could do. And I very gradually built up the full thing. Now I do that same trail 3 or 4 times a week, at least. I don't do that much really intense exercise anymore, and I do some. I still do some kite surfing, but I mainly do kayaking and biking and hiking and walking. That you look at the healthiest people on earth, they're people like sheep herders. They just walk all day. They're not doing intense exercise. They're doing just moderate, low-intensity exercise that generates endorphins, but not so much that it's causing inflammation in their tissues. So in other words, you're going to cause a lot less inflammation by walking a 5K than you are running a 5K, and you're going to generate endorphins a lot longer because you're going to be doing it longer. That all being said, intense exercise is what a lot of us live for, and I think it's important. But during your recovery, you just have to back off. As things get better, you can get back to doing some things that you really like. Again, I am doing some kite surfing now, even at age 60. I am still surfing. I'm back out surfing. I didn't do that for a long time. So I've pulled in some of those intense activities, but I still keep up with those low-intensity activities more often and more consistently. So yoga, tai chi, walking, all of these things consistently, that's what will get you to the finish line.
Awesome. It's always inspiring to hear that you're still able to do those things, especially after having it so rough in your 40s when you were dealing with all this. So you and all the other people that have gotten through it, because there are a lot of folks out there, and especially with more research and more conversations about this, hopefully people are finding better ways to get around it and get themselves well. So thanks for sharing that, Dr. Rawls. We've got about out of time here, but a lot of people are asking, can they work with you? Will you be seeing patients again anytime in the triangle as an integrative Lyme MD? Or could their natural doctor work with you, like do a consult with you? Any
Sure.
feedback there? What do you think about that?
Yeah, I did a medical practice. Originally, my original career was practicing obstetrics and gynecology, and the every second to third night call is what was my system disruptor that ended up causing me to become ill. But after that, I opened a medical practice, and the state of our medical system makes it very difficult to do what you really need to do for people. So if you're going to accept insurance, you're never going to get reimbursed for the kinds of things that you need to do, or certainly the time that you need to invest to take care of someone. You have time to pass out prescriptions, and that's about it. If you do, I found that the more that I help people, the more time that I spent with them, the less revenue we generated, to the point that it was really hard to pay the staff. And that's what a lot of integrative and Lyme doctors end up facing, is once you have that brick and mortar and all the employees and all of the things that come with it, it's really, really expensive. The overhead in offices is typically 70%. I mean, it's huge. So you end up doing a lot of labs and a lot of procedures that you might not put out there first, or it might not be the absolute best thing for the patient, but it might help them, and it generates in revenue. And you have to generate a lot of revenue to run a office like that and take home a paycheck. And that's just the sad fact about it. So I think and it leaves very little time to really sit down and talk to the patient and counsel them. I can talk to people doing what I'm doing now. I do consults. I'm not doing a lot of consults because I'm spending so much time writing and researching. I can reach more people through media like this, through writing, through blogs, through books, and we want to add even more video things, and we want to build out our restore programs. I can do more good and reach thousands upon thousands of people and not become so stressed that I'm ill because I'm having to go and work in an office and see 20 patients a day just to make ends meet. So I don't think I'm going to be off opening another office again, but I will continue trying to disseminate this information and reach out to people until we really solve this problem and help people understand that we've got to approach it from a different angle.
Great. Thank you very much, Dr. Rawls. We'll let that be the last question. And thanks so much for all the research, and hope that was helpful for everyone. We will definitely do these again and pick Dr. Rawls' brain on the next webinar.
All
So
right.
thanks, Dr. Rawls. Please stick around.
Thanks for joining us, everybody. We are going to have many more webinars, lots more content, lots more research and writing. There's a lot more stuff coming your way. Thanks.
Awesome. So please do stick around, guys. We've got just one or two more things left. One resource that we've worked really hard at building at Rawls MD is a Lyme support database. And so if you go to lymesupportdirectory.com, that will take you to a database that we've curated of Lyme disease support groups all over the country and other groups. And look for some help there. A lot of people also asked us, what's the best treatment for option in Connecticut? What's the best place in Colorado? We try to be informed, but we don't know it all. So it's important to get connected with people in your area for sure. So do that. You can search there and hopefully find a group in your area. If there's one that's not listed, please add it. We've had people reach out to us saying that they're going to start a group in their area, and they're getting people together. So That's great. Let's continue the conversation and keep the wheels turning in this direction. So check out limesupportdirectory.com. And then if there are any questions that we didn't get to answer tonight, we've got great health coaches that have been trained by Dr. Rawls. They've been through Lyme themselves. They've had training as a chef, a meditation teacher, yoga teacher, and then they're continuing their herbal knowledge training with Dr. Rawls and just overall understanding. So they're amazing resources, a really affordable way to help guide a lot of aspects of your recovery. And then of course Dr. Rawls is also there for more complicated kind of troubleshooting topics, is usually where folks call upon him. To learn more about that, rawlsmd.com/consult is the place to go. Really appreciate you guys joining us tonight. We hope you will be here in the future. We're going to continue to do these, and we'll see you on the next webinar. Good night.